with Central Ohio Spine and Joint. Today what I wanted to talk about was a technique that we've added within the last about a year in the practice here, which is trigger point dry needling. I've got Jasmine with us here today. We're going to show you exactly what trigger point dry needling looks like. We're going to talk a little bit about the benefit of it. So dry needling has been something that we've wanted to add into the practice for a long time now, mainly because we feel trigger points are a huge component of our patient's pain. Trigger points, if you want to come on over here, are essentially the knots that you feel within the muscles themselves. Easiest area to point out here would be these traps. If you feel like you've got a little bit of a taut band or a knot within this tissue, that's actually a trigger point. So what a trigger point does is it can actually create localized pain in these areas, but it also will refer pain down into either in this area like the arm or into the mid-back itself. So with the dry needling, we use a small thin filament needle here, which is like an acupuncture needle. And what we do is we essentially try to palpate and find the most tender kind of trigger points. And for Jasmine here, she's got a real big trigger point right on this trap here. So what we're going to do is we're going to insert the needle right into that trigger point. I'm going to push it in, and the needle sits right in the muscle itself. So, you could ask Jasmine here, you hardly feel anything with it, maybe just a little bit of pressure. It's nothing like a syringe. It's nothing like getting your blood drawn. Thin needle, it's actually the diameter of your hair. It's very non-painful. So if we look at what the benefits of dry needling are, in this case, when we're putting that needle into the trigger point itself, it's creating a couple things. It's actually bringing a little bit of blood flow to the area, which brings some mediators that help some of the chemicals in the area. It also helps increase the range of motion by decreasing the tension in the tissue. And then as well, it actually decreases the excitation of the nervous system itself. When you have that tight kind of spasm in the muscle, everything's kind of excited in that area. The needle itself, when it goes into that tissue, just gets things to relax. So we use trigger point dry needling in combination with the majority of services we use here in the office. So for Jasmine, we'll get her adjusted, we'll do a little bit of manual therapy, and we'll also do some exercise in this area to make sure that what we've done from the needling standpoint actually sticks for the long term. So if you guys have any questions about trigger point dry needling, make sure to comment below. If you feel like you have those kind of knots or trigger points within your tissue and you're interested in learning more about it, we'd love to hear, we'd love to have the opportunity to see whether this could be something of benefit for you. So leave a comment below, and we'll see you guys soon.